Signs that a health plan may not be following parity law. So we're going to walk through some common warning signs. Under parity law, health plans can't cover fewer visits for mental health or addiction treatment than for other types of care. So if there is no limit on the number of visits to an endocrinologist for diabetes, there should be no limits on visits to a psychiatrist, a therapist, or an addiction counselor. And the number of covered days in psychiatric hospitals must be equal to the days for other kinds of inpatient treatment. So these are called the quantitative treatment limits, like we discussed earlier. So just a reminder, if there's a term that you don't understand, look at your toolkit. Health plans usually comply with QTLs because they are written into the documents reviewed by the government when the health plan applies to do business. So if there's a health plan that wants to come into Tennessee, they have to apply to the State Department, and they will have the rules written out about how they compare the number of days for mental health and substance use care versus medical care. Okay. So another red flag is that the health plan may be violating parity laws if it doesn't cover residential treatment or partial hospitalization for mental health or addiction. But it does cover step-down care in a skilled nursing facility after a stroke or a heart attack. So you can see the imbalance there. Some health plans will not pay for mental health or addiction care if the member quits before treatment is complete. This may be a parity violation if the plan doesn't place the same requirement on other types of care. So you wouldn't deny care for somebody who no longer wanted to take a cancer treatment, but some health plans would deny care if a person did not continue through the recovery or the treatment program. And that could be a parity violation. So let's talk about higher costs. Health plans cannot charge more to their members for mental health or addiction treatment than for medical or surgical care. Out-of-pocket costs include deductibles, co-payments, and co-insurance. So I know many of us know what these are, but we're going to break them down and just look at these definitions. So a deductible is how much you have to pay in medical bills before the health plan begins to pay. Added deductibles for mental health and substance use care are not allowed under parity. A copayment, also known as a copay, is a set fee that health plan members must pay for each visit. Parity law requires copays for mental health or addiction treatment to be the same as for similar types of care or other conditions. Be aware that co-insurance and copayments are not the same. Copayments are a set fee per visit, while co-insurance is a percentage of the total cost of treatment. For example, a plan may have a $20 copay for a doctor's appointment, but the pharmacy benefit may require a 20% co-insurance. So if that medication that you get is $1,000 a month, the member would owe $200 each month if the co-insurance is 20%. So that's a big difference than $20 per visit. So it's really important to look at that fine print when you're picking a health plan. You have to look at how much your copay is and your co-insurance is. Co-insurance usually involves levels or tiers of out-of-pocket costs. And we see these tiers used especially with medications. There's tier 1, tier 2, tier 3, and tier 4. For tier 1, that's your generic medications. And the health plan would pay the full cost and the member wouldn't owe anything in a lot of cases. So for medications on tiers 2 through 4, members would owe an increasing percentage of the cost with each higher tier. So your tier 4, you're going to pay a bigger share than the tiers 3 and 2. So here's where parity law kicks in with the medication tiers. Parity laws require health plans to charge no more out of pocket for psychiatric medications than for medications to treat other conditions. That means that a generic antidepressant or antipsychotic medication should be on tier 1 or 2 with little or no copay. The selection of brand name medication on each tier should be similar across the various medical conditions. So we'll look at another type of treatment limit. So this involves how health plans review requests for mental health or addiction treatment compared to other types of care. So you can't have two different sets of rules. Treatment reviews in general have 3 goals. And the first is to make sure that the best type of care is being provided. The second is to prevent the wrong type of care from being provided. And finally, to reduce the health plan's cost. Health plans decide whether care is medically necessary. If you've ever had to go to the hospital, there's a review about medical necessity for you to be there and the kind of treatment that you get. And this is important for the health plan to know when deciding whether to approve or deny care. And they may deny care because it is not approved for certain health conditions. It may only work under certain conditions. The effectiveness or the safety of the treatment or medication is in question, or the treatment costs are more than other types of care for the same condition. So this is where the non-quantitative treatment limits come into play. And this is where parity problems usually appear. It's in the policies that address medical necessity. And the way insurers do this for behavioral health care is often more strict than for other types of care. Under parity law, health plans must share the standards they use to approve or deny care if the member asks for information. So if you think that your behavioral health care is being treated differently, if you've been denied care, you have the right to ask your health plan to present to you the standards and criteria by which they consider medical necessity. And the plan must also share this information with your provider. If your provider is acting on your behalf, they must share it with the provider. So we'll get into prior authorization. So prior authorization and step therapy are also examples of non-quantitative treatment limits. So this is the policy and procedures. Okay. So prior authorization or prior approval means that the member or provider must contact the health plan to request coverage of treatment. If prior authorization is granted, the plan will cover the treatment, although the member may still have an out-of-pocket cost. Some plans require a new prior authorization each year or every time a member reaches a certain number of visits. You might have seen this if you have physical therapy. You know, you're approved for so many visits, and then you have to get prior authorization for like another set of visits. So if prior authorization is not granted, the plan won't pay for the treatment. Step therapy, this is also called fail first, is a type of prior authorization. So with step therapy, the member must first try a common, less expensive treatment or medication that has been proven effective for most people with the given condition before they can step into the recommended treatment. So now we'll talk about another red flag when it comes to parity, potential parity violations. And this is providers, the availability of providers. Providers must go through a review process, and they may or may not be accepted into a health plan's network. These providers agree to work for a reduced rate and follow the plan's procedures, and in exchange, they get client referrals. If the insurer pays a different set of rates to mental health providers and substance use care providers than other types of providers, that may be a parity violation. When health plans limit the number of health providers in their networks, it makes it easier for them to monitor the quality of care given by their providers. They can pick and choose what providers are in their network. But with fewer providers, health plan members have a really hard time finding an in-network mental health or addiction treatment provider who has appointment openings or even accept new patients. I would love to see in the chat box how many of you have dealt with this. How many of you have gone to make an appointment and you have to wait weeks to get an appointment, or you might find that the provider network directory is not updated and the person is not maybe not accepting new patients. So the directory, what often happens is that the directory may list providers who are no longer practicing or who aren't taking new patients. And this is actually called a ghost network. And there have been discussions in Congress about cracking down on health plans that have these ghost networks. Sometimes when you go look at the provider directory, it may look like the plan has a physician or therapist in the area, when in reality, the provider works at several different clinics and only takes a few health plan patients in each location.